Well, good morning. Florida is in the headlines again. This time, not for hurricanes, thank God, uh, or elections, thank goodness, but for something even more personal: our children. The state is moving to end that school vaccine mandates. And depending on who you ask, it's either liberation for parents or it's a countdown to catastrophe. Now, the Florida Department of Health can already strike down certain requirements. The newer vaccines, things added by administrative rule, but like measles, mumps, rubella, polio, those are wired into the state law. To change those, um, the legislature would have to act. When lawmakers come back in January, they'd have to decide whether Florida keeps some of those pillars or clears the slate completely. Remember that. Some of them, like measles, mumps, rubella, polio, are hardwired into state law. It would take a legislative change to make a difference there before you get everybody gets all silly and crazy. We're away from that. So that's important. The headlines will scream, Florida ends the mandates. But the fine print says lawmakers could keep certain vaccines. They could. So the possibility of a carve out hasn't gotten much airtime because partial rollback isn't really sexy, and you can't get people riled up, and you can't get people cursing each other out on X or on Facebook. You can't. So that's why I brought that to you, because maybe that's something that you hadn't thought about. Now, the public health folks anchor their case in, you remember this phrase? Herd immunity. When enough people are vaccinated, disease hits walls instead of victims. We heard that too, didn't we? The more cracks in the wall, the easier it is for something like measles to slip through. Critics counter, if the shots work, critics counter this. If the shots work, why demand my child to take it? If the shots work, why require me to take the jab? Golly, we've been through this. Why is my family's risk required for the collective? Some of us might remember Joy Reid saying that our children don't belong to us, they belong to the collective. Remember that? Because that's the tension Florida is servicing. Okay, it's individual choice versus population defense. All right, before we go any further, let me thank our sponsors, the great folks at 7 Weeks Coffee. This isn't just about a better cup of coffee. Every bag supports pro-life organizations across the country. So if you want your morning brew to stand for something more than just caffeine, head over to 7weekscoffee.com, 7weekscoffee.com, and use the link in today's description. You'll see that down in the description. Drink coffee, save lives. All right. Now, of course, that union, and I'm saying it that way on purpose, I want you to research it. That union, the American Medical Association, dropped a sharp line. They said bluntly, this unprecedented rollback would undermine decades of public health progress and place children and communities at increased risk. It's a dramatic warning for sure. And yes, over time, maybe lower vaccination rates may mean higher risk, maybe. But here's the nuance missing from the sound bites. Outbreaks are not automatic. Diseases don't appear just because laws change. They appear when they're carried in. If most Floridians are still vaccinated the first months or even years, maybe decades, after repeal may look just like it does right now. The danger builds, if there's a danger, it builds slowly. As maybe clusters of unvaccinated kids form in certain communities or schools. That's when a traveler brings measles from overseas. and suddenly the cracks get tested. Still, you can already script the coverage, right? You already know what those breaks are like, right? The first confirmed measles case will be treated like a disaster movie trailer. Red maps, breathless reporting, warning of exponential spread. It looks like Contagion, right? Even if it's one child in a state of 22 million people, that spectacle fuels the political narrative. Freedom versus chaos, even when the reality is far more gradual. All right. This segment is brought to you by my friend Christine Vasconcello over at Bloomingdale's Flower Shop. For decades, Bloomingdale's has been a Tampa stalwart and a trusted local florist. Family owned, her and Pops, it's the best on delivering everything from birthday bouquets. Yeah, today's my birthday, and to wedding arrangements. When words aren't enough, flowers say it best. Call Bloomingdale's or visit bloomingdays.com, bloomingdays.com, bloomingdays.com to order today because it's my birthday. It is really. Okay, so what we have is evidence versus trust. The problem is that the level of trust is so low. So on one side, we have evidence-based mandates. Advocates argue that they're the only reliable way to keep herd immunity intact. So on the other side is deep, deep distrust. Years of shifting COVID guidance, big pharma profits, and government overreach convinced many families that the mandates are abuse, not protection. But there is a middle layer missing in this conversation. Doctors. If mandates drop, it won't just be the Wild West. Pediatricians and family doctors will be at the front line. They'll have to talk to parents directly, explaining risks, showing data. A great many parents still trust their personal doctor, their personal pediatrician, even if they don't trust the CDC. That one-on-one trust may prove to be more powerful than the law ever was. Now, don't forget, the legislature could easily say, fine, no mandates for newer shots, but polio and measles stay. That scenario hasn't been given any oxygen in the press, but it could be where things land. It could be the most contagious, historically devastating diseases under mandate while giving parents the discretion on newer vaccines. If that's the final outcome, Florida won't have ended mandates. It will just have redrawn them. All right. Here's what's possible in the short term and the medium term and the long term. Short term, Florida classrooms look exactly the same. Kids still show up. Parents still sign exemption forms. There'll be no outbreak day one. In the medium term, vaccination will dip sort of unevenly because, like we just said, a lot of people will still do it. Their doctors will convince them. Their PDs will still convince them, and they'll still do it. And some areas it'll stay. It's going to stay very high. People will still do what they've always done. I mean, we're talking about when in 1990 when the number of vaccinations just skyrocketed. There was a bunch of parents doing it, and those kids are having kids now, and they did it, and they'll continue to do it. It isn't like everybody in Florida is gonna like that. We're done. Zero. That's ridiculous, right? Others are going to drop off. That creates some hot spots, maybe. Long term, if an outbreak hits, Florida becomes a test case. Did freedom weaken the herd immunity? Or did trust in doctors keep enough families on board? That's it. mean, it's super easy just to blame the politicians because politicians oftentimes deserve every bit of blame. But in this particular case, was the distrust of doctors, of the medical profession, and doctors, people's personal physicians, weren't good enough to save it. Before we go to our third break, listen, my own personal case. Now, I don't know if this is going to make the YouTube thing, but a couple of years ago when COVID broke out, uh, because I'm an older person, because today is my birthday, by the way. My doctor said, actually, I went to my doctor and I went there for something else. And I said, well, what do you think about me taking the vaccine? And he said, you should do it. And he laid his case out. He laid his case out. He said, you're African American male who's older, who has these other conditions, and he laid his case out beautifully. He did. I listened to him. I heard I listened to him. I weighed it all out, and I said, "Nah, I won't do it." And then he smiled and he said, "Yeah, I kind of figured that." But I said, I thanked him for being honest with me and laying out the things that he thought were important. He didn't dog me out. He didn't call me names. He just said, "Hey, listen, this is why I think you should do it." And my idea is that this is the relationship that you should all have with your doctors. I mean, you should all have with your pediatricians. And if you are convinced, go home and pray about it. If you're convinced that you should give your kid XYZ vaccination, then do it, for goodness sakes. Do it in faith. Lay hands on the doctor. Lay hands on the medication. Lay hands on your child. However you have to do it, do it. But what's going to really happen, and what's not being talked about, is that this is all going to fall on the doctors. This is all going to fall on them. Not just automate the process and have them just like a factory. This your baby? This your baby? You have to talk about these things. People are going to have to learn about these things. People are going to start being responsible for these things. They're going to. And I think that part of it, that part of it is the best part of it. All right. If you're tired of mainstream spin and you want to keep independent voices alive, here's how you can help. Join us over on Patreon. Your monthly support makes this program possible, covering everything from equipment production to keeping the lights on here at Fightback Media. Head on over to patreon.com/morning report. That's patreon.com/morning report and join us today. Stand with us for truth, courage, and independence. Folks, Florida isn't just debating shots. It's debating trust. Trust in medication, trust in government, trust in your neighbor. The American Medical Association Union says the rollback undermines decade of progress. Parents say it restores choice. The media will leap on the first measles case like it's contagion. They will. But the stories nobody telling is, again, remember this? The legislature may not touch every mandate. And doctors, you guys, not the politicians, will end up carrying the persuasion load. Parents still trust their own physicians and PDs more than any state agency. That quiet fact may decide whether herd immunity survives without mandates. My name is Willie Lawson. This has been the Morning Report. Until we see you again, go out there and learn to love somebody. And for goodness sake, y'all take care of yourself. We will see you when we see you. Bye bye now.